Positional release for the piriformis, and actually this one can be quite useful, quite similar to what you would do if the glutes were in spasm. I'm going to show you two ways to doing this because I think depending on your body mechanics, how big your client is, you'll find one way or other easier. And I think what's key to note is remember it's about shortening a muscle, and although we talk about posterior generally requires some extension and some fine tuning, actually once you can bring that head of the femur closer to the sacrum, to the pelvis, then you're going to get ease. So there are other ways to create that without having to go into extension. So the first thing we're going to do is to palpate and find that tender point. Remember, if we're looking at the piriformis, we want to be looking from that head of femur and across to the sacrum. We want to be deep to the glutes as well. Okay. Around here, do you feel some tenderness?
Yes.
Yeah, so we're finding that tender spot. You may have already found it with your client mid-treatment. So we're going to call that a 10, and now I'm going to just position your leg and your hip into different positions to try and ease that to a 2 or a 3. So I'm going to take the client's leg. If you find it easier, you can bend their knee and lift their leg up, because that allows me, certainly this client has quite long limbs, to move that leg with greater ease. If you have it straight, you can do that too, especially if your client's smaller. But if you do have the whole leg, then what you want to ensure is that you're supporting the client's knee. So the top of this hand above the knee, and then the leg resting on your forearm, again to ensure they're not locking out into hyperextension. Okay, so we're just going to come back. I'm going to bring the leg into 90 degrees, hand under, but above the kneecap, above the patella, and now we're going to find that tender spot. So make sure that the hip is back in neutral. Okay, so we're on that spot. Now, I'm going to bring the hip into extension, so I'm into my lunge, and a simple lift, lifting my heel up to get that height. Now, has that decreased the level of tenderness?
Yes.
Great, and where are we on that scale?
Like a 5.
Okay, straight to a 5. So generally that flexion or extension gets us a lot of the way there. Now, piriformis externally rotates the hip. So actually if I externally rotate it more, that should shorten it. So I'm now just going to rotate. So as you can see, the foot's dropping in, and I'm just slightly rotating that leg and that hip out. Has that decreased it further? Okay, so that's decreased it further, and are we around a 3? Yep, so now we're going to hold that for 90 seconds. So the hip is in a slight, maybe 5 degrees of extension, and it's externally rotated. And just breathe, nice long deep inhales and exhales. And we're holding that for a full 90 seconds. So you want to ensure that your posture is good. Even when you're palpating that tender point, it's not about pushing. I don't want to see tension in the shoulder. It's just holding that tender point. Very much like we would with a trigger point, we're not looking to place great amounts of pressure through there. It's really just to help us monitor where we're at. So once that 90 seconds is up, as always, very important, a slow return to neutral, bringing that leg out of rotation and abduction back onto the bed, and slowly and controlled bringing the leg back down. And on palpation, you'll feel that real difference in terms of the level of tone. And how's that in terms of tenderness? Great. Positional release for the piriformis. If we were to do that in glutes, the real difference there is you might fine tune it and find that different directions get greater levels of release, and also the tender spot might be somewhere different. I often find the tender spots in glutes tend to be more towards the iliac crest, more towards the top of the pelvis rather than down at the femur. But every body is different, so you find that tender point and find the movements that help create ease. If your client's quite large, you're quite small, or you find it quite awkward to hold that position to bring it into ease, then another way to do so is to bring the leg off the bed. So could you just shuffle over to the edge of the bed for me, please? Oh, towards this direction, please. And what we're going to do is actually bring the leg into a bit of hip flexion, but then we're going to use a lot more abduction to bring that head of the femur closer into the pelvis. So again, we want to palpate that tender point. Okay, have you got that 10?
Yep.
Okay, and now I'm going to bring the leg up. I'm going to lift underneath it again, but this time I'm going to bring the leg off the bed. So I'm actually dropping it. Now my hand is under the knee, which allows me to get into a nice deep squat, which is easier to hold if it's quite a big and heavy leg. So I'm bringing the knee to about 90 degrees and there's some abduction there as well. So where are we on that scale?
Yeah, like a 3.
Okay, and now we're almost there. So if we're at 4, we want to get a little bit more. I'm just externally rotating that hip. Okay, so as you can see, the foot has come in, the knee has come out, and that's further easing into that piriformis. Has that dropped to a 2 or 3? Yep, and hold. So we're just going to hold that for 90 seconds, and you might find this just an easier position to be in. Coach your clients to breathe, to reset, hold it for the full 90 seconds, and then a slow and gradual return. And simply repalpate.